views and opinions expressed in this program are those of the participants and do not necessarily reflect the views of BronxNet or the program underwriters.
Welcome to Public Health America, a 30-minute program on BronxNet where we talk with national experts to promote health and social justice. I'm your host, Dr. William Latimer. We begin by focusing on a current health topic from the COVID pandemic to cardiovascular disease. Our goal is to provide you with not only the best science, but practical tips to live a healthier life. On Public Health America, we also celebrate what studies have long documented, namely the unparalleled value of a college education by setting the stage to pursue a career of your choice, increase lifetime earnings and opportunity, and champion the ability to engage in civil debate. But for many, finding a path to college is neither clear nor certain. What if you're a high school student with supportive parents, but feel daunted by the prospect of being the first in your family to attend college? What if you're a single mother or father and want to attend college, but have no childcare? On Public Health America, our expert will also talk about decisions they made and support they received that helped them beat the odds. By sharing one or two life lessons, their stories may provide you with the inspiration and method to realize your dreams. This is Public Health America. Welcome to Public Health America. I'm your host, Dr. William Latimer. It is my pleasure to have with us today Dr. Yusuf Ransome, Assistant Professor at the Yale School of Public Health. Yusuf, welcome.
Thank you, Dr. Latimer, and thank you for having me today. It's a pleasure to be here.
Thank you so much. So I know you've been doing some cutting edge work on the intersection between health, mental health, and religiosity, specifically what happens when places of worship close. Set the table for us. Tell us about your work.
Thank you for the opportunity. So as mentioned, I'm a professor in the School of Public Health, and my work largely focuses on the social and cultural aspects of society and how that influences population health. So two of the things I study is the role of social connectedness, social cohesion, how that impacts health, as well as religion and spirituality. And so today I'll focus on religion and spirituality by first talking about a project that really spoke to me as a resident of New York City. And I know we'll get to that in the second segment, but just to kind of give some context in terms of what I'll explain. So the project really started by understanding the role that religious institutions play in the individual's health, right? So if you think about in communities of color in particular, religious institutions serve many functions, right? Often they're places of worship for individuals, but we see too that in communities of color that sometimes are challenged by social and economic conditions, whether that be sort of structural racism, whether that be inequality, churches often provide a place or an informal social safety net. So one of the things I saw growing up in Bed-Stuy, for instance, is that several of the churches in the neighborhood where I grew up, you will often see them on Sunday or Saturday, there's sort of the church service, but on Tuesday or Thursdays and Fridays, they would serve also as soup kitchens. They would serve as places where individuals can come in and get sort of treatment for mental or other health related issues. And so you started to really see the role that the church provides for individuals who are marginalized economically. And so in addition to that context, we understand that, well, perhaps there are psychological resources that institutions provide for individuals. And perhaps there are even other opportunities for faith-based partnerships with public health institutions. And we've seen that quite poignantly with the COVID pandemic, where right here in New York City, for instance, where New York City Department of Public Health, they partnered with several religious and other faith-based institutions to provide COVID testing in predominantly African-American communities. And then later on, we've seen now that the same public health partnerships to promote vaccination in churches. So we begin to see a clear role for the institution outside of sort of the religious functions. And we understand, for instance, how having that partnership might impact the individual's health. But the question becomes, what happens when these places are no longer there? Or fewer of those places in the neighborhoods. And so that's kind of where I am taking the work today because of something that I noticed over the past couple of years, living again in Bed-Stuy when I visited home, walking through the neighborhoods, started witnessing that several of those places are either closed or they're demolished. And I began to ask the question, what would happen whether these same places were no longer available? What impacts would that have on health? And so that's where my research program today is set out to understand by focusing on the number of institutions within a neighborhood, look at the changes in those institutions across time, and begin to make correlations with individuals' health.
Sure. I mean, so that was a pretty that's a broad agenda. I mean, I guess a lot of things come to mind. Certainly, one could intuitively grasp that the variety of functions that a place of worship provide, not in exclusion to their primary mission, which is to foster faith and religiosity and connection to the religious community in which people live, but the other community-based aspects like the soup kitchens providing a wide array of services, including things like counseling and mental health counseling I've seen happen. Let me ask you this. It seems to me that quantifying the potentially enormous benefit of what places of worship do for a community might be challenging. Is that like we want to prove that what they're doing actually really matters and makes a huge difference? How do you do that? Is that a fair question?
Yes, no, that's a brilliant question. And it's actually part of the reason why this project is ambitious, because there are a couple of things. When we first think about associations, right? So typically associations, we quite limited to what we can prove, right, in terms of causality, right? And so that's always one of the challenges we say in a jargon, the methodological challenges when we try to understand the role of religion and health, right? So there are several sort of potential or unexplained or alternate answers or hypotheses. And so what I'm setting out to do is to say, what are the mechanisms, right? So precisely one can assume anecdotally, for instance, by seeing the soup kitchens, etc., by seeing the services, right? But we want to be able to quantify that. So I think that's sort of the rigor that I'm bringing into this project to say, well, intuitively, yes, we can see these sort of services while we walk by the streets, but how can we actually quantify this? And how can we actually link this to health? So I think that's kind of the heart of the project. And this work, by the way, isn't new, right? There's a long history of looking at the religious ecology, for instance, and looking at the role that religion plays in terms of social networks, social integration. And there's several scholars that sort of link that to things like suicide. And so we just really want to improve the rigor of the work by actually detailing what are some of the services. So practically, what does this look like? Well, once we have, for example, that database of institutions that, let's say, were closed between 2000 and 2019, one can go back and say, well, what were some of the things that this specific institution provided? Did they provide, for instance, a soup kitchen? Did they provide sort of daycare? Did they provide adult care? What were some of the contributions to the community? And so we begin to build a database with these types of metrics. And that's what we use to identify what we call the mechanism. So one hypothesis might be, well, an individual's health might be worse in communities where there once were a greater number of soup kitchens, for instance, and over time, these places no longer were available. So how does that individual cope, for example, with food insecurity, knowing that this social safety net is no longer available? So these are the type of questions that we'll be able to answer once the project is completed.
That's great and very important. Let me ask you this. So what is the catchment area of the research you're doing? I mean, in other words, like it could be vast, it could be narrow, it could be, there's no right or wrong answer. I'm genuinely interested to know. And then define place of worship. And what I mean by that is, are you going to synagogues? Are you going to Catholic and Protestant churches? Are you going to places of worship for Muslim? Like what? Who are
Yes.
who are you including?
Yes. No. So again, great question. So so there are several phases of the project. So as mentioned, I really sort of started this out from the neighborhood of Bed-Stuy in Brooklyn, right? Just literally walking around the blocks in New York City, within 10 or so blocks away from where I live in Bed-Stuy, I would see several churches close. I really kind of started there. But the project is actually nationally, right? So while I focus on New York City as a case study, by, for instance, being able to actually literally go to the places, quantify them, see what they were, call folks on the phone. The database that I've generated is going to be national. So how I'm defining churches or places of worship, it's going to be broad. So for this specific example, we are using the North American Industry Classification Codes, and that is based on how does an organization classify themselves for tax purposes. And so there are several indicators, right? There are churches, there are mosques, there are synagogues, there are temples, there are sort of religious institutions. So there's a array of sort of classifications that each institution uses to classify themselves. So I'll be able to look at what are the differences by types of institution, for instance. The places that are closing more likely to be churches compared to mosques or compared to temples, right? And then furthermore, I'll be able to even classify, well, what types of churches are there? What denominations are there? Protestant, Catholic, sort of historically Black communities. So the scale and the scope really depends on focusing in New York City, where sort of the project, the genesis, where things began, but really broadening this out nationally to understand that this is not only a local phenomenon, it's actually something that I've been seeing and reading across studies in Philadelphia, in Baltimore, in San Francisco, in several places.
Sounds good. Sounds big. Sounds complicated. We just have a couple minutes left. Give us you've alluded to this already. Like, for example, I'm presuming that what you meant is that rates of suicide go down when someone is connected to a religious faith-based institution. What are some, and you've talked about the predictors or the variables that might promote health and well-being. What are some of the outcomes you're going to look at?
Yes. So some of the outcomes I plan to focus in on sort of self-rated health for one, the individual's own ratings of how they perceive their health. And we know that self-rated health is actually a very strong predictor of mortality, right? So that's one. We're going to look at mental health. We were seeing during the pandemic that there's a sharp rise in things like depressive symptoms and anxiety. And so we want to be able to look at well-being in addition to the physical and mental aspects of health, right? And well-being is how do we understand happiness, right? What are some of the other positive psychological aspects? So we want to basically quantify a spectrum, and that is going to help us understand a complete sort of response of an individual's health, as well as there are going to be secondary outcomes where available, such as the rates of suicide and other types of chronic related health conditions.
Makes a lot of sense. By the way, the timing of your segment, it couldn't be better, as it will likely serve as the kickoff of a series within Public Health America, where we're going to focus on interfaith type initiatives and councils regionally and nationally that across faiths are working to accomplish the very aims that you're examining and want to support. We're going to take a quick break. When we return, Yusuf Ransome at Yale School of Public Health will tell us a little bit about his life journey and how his undergraduate experience set the table for his excellent profession as opposed to a job. This is Public Health America. I'm your host, Dr. William Latimer. We'll be right back. Welcome back to Public Health America. I'm your host, Dr. William Latimer. We're here today with Dr. Yusuf Ransome, assistant professor at the Yale School of Public Health. Yusuf, we always start this segment with the same question. Where were you born, and what were some of your formative experiences?
Absolutely. So I'm proud to say that I was born in the island of Trinidad and Tobago. And I grew up in Trinidad and spent some of my formative years in high school there until I immigrated to the United States to meet my mom, who was here. And so around the age of 14, that's when I came to the US and was able to go to high school here as well. I went to Samuel J. Tilden High School in East Flatbush, Brooklyn. And from then on, when I graduated high school, went on to Brooklyn College in the city of New York. And so my formative years was really filled with experiences growing up as an immigrant, right? Really seeing some of the challenges that people face when they come to a new country, particularly seeing some of the struggles that my mom went through, for instance, to be able to put me through school and support my educational activities. So it was something from a young age I really took seriously to understand that there are several people who give up their lives, right, and make really huge sacrifices, having to leave loved ones and family in their home of origin to come to United States to really make a difference and to make a better place for their children and their family. And so I really embodied those sort of things that I've seen, the struggles. And throughout life, I really try to keep that in what I do. And that really motivates me in terms of being able to focus on what it is that I need to achieve in order to be able to create a better experience, not only for myself, but my family and the extended community of immigrants, of young Black men, of people within Brooklyn, New York City, and the general Caribbean. So I would say these are the things that sort of propel me to continue doing what I do each day.
Wonderful story. So tell me a little bit about your experience at Brooklyn College. What was your major? What were there challenges that you faced? Were there protective, positive factors that helped you to succeed? What was your time like there?
Absolutely. So I would say I had a brilliant time at Brooklyn College. And one of the things was several things really in terms of being still located in the city, right? Being able to, I was actually a commuter student. And so I traveled to school, take the B8 in the morning to the 44, take the 44 back to the 8 at night. And so I really had an opportunity to be immersed in the culture, but yet still kind of be home and be independent. And so the experience at Brooklyn College in terms of the education I was provided, an unmatched education. I studied business management and finance. I always kind of wanted to get into the business field for a number of reasons, both because I enjoy this is something that I feel quite comfortable at, and it's something that really sort of gave or brought the biggest joy. Now, in terms of how I ended up into health, that's another interesting story that is connected to school. And so, when I graduated, actually from Brooklyn College, my insurance at that time was under my mom's name. And so, once you graduate, you typically have a short buffer period through when that insurance no longer is valid, right? So, I basically aged out of my mom's insurance. And during that time, I actually had a finger that was broken and really tried to go access care to get this taken care of. And I realized it was such a difficult time just to have this sort of minor procedure done. And it's at that point I became awoke in terms of the kind of challenges that one may face as an immigrant, but in generally the healthcare system on a whole. And so that's kind of where I set off my journey on working on understanding the healthcare field. And it was yet again at Brooklyn College where I sort of went into this idea of pursuing healthcare, but ended up focusing broadly on public health as I began to work in the health programs office. So I'm quite there's a lot of sort of great experiences, both from just sort of physical, real things that happened to me, but also seeing vicariously through the community of people that I belong to.
So, clearly a personal experience was key in taking a path that you ultimately took. Was that associated with a graduate degree in health or public health of some ilk?
Yeah, so I would say to students who are looking. So one of the things I would follow up on is that, well, my original intention was to pursue then a Master's of Public Health in Healthcare Administration to really understand how does the healthcare system function? How can we change some of the ways that things are administered in terms of access to care, for instance? And that was sort of my passion, to fuse my business training with an understanding of the healthcare system to make that change. But as I began to really go in more into the field and then started taking classes at Brooklyn College and then volunteering or applying my work in terms of understanding and doing health programs, I started understanding and seeing different paths. And so that's kind of really what led me to where I am now, which is starting off on one journey to do healthcare administration, but really ending up in another path, which is focused on behavioral health, population health, understanding how systems generally impact health. And so that's one of the value I would promote highly in terms of going after that higher education, right? So I started off in one place, but because higher education opens up so many doors and opportunities for you, you can then go into a path that is perhaps much more of your calling. And that's just the beauty of being able to be open-minded, being able to pursue what you love, and just let that process guide you into the field that you're supposed to be and the place where you're going to have the biggest impact in your life.
Very good. So then, just to sort of punctuate that excellent summary, what were your degree or degrees in?
Yes, so after Brooklyn College, I graduated a bachelor's of business management and finance. Then I went on to the University of Michigan and I did my master's of public health in health education and health behavior. And
Got
then
it.
from that, I came back to New York City and went to Columbia University, Mailman School of Public Health, and did my Doctor of Public Health there. And so that's kind of the journey going from business into public health, further on into public health, and now I am a professor in the School of Public Health. And so that's sort of the journey I would encourage students to be able to take the ride, right? Trust yourself, pursue something that you enjoy, because you never know where it's going to take you. I certainly didn't think or didn't plan in my trajectory that I would be a professor today, but trusting an educational journey, it really took me to a beautiful place where I am today.
So, yes, very helpful and all phenomenal places. So you had mentioned earlier that, emigrating from Trinidad and Tobago to the United States to join your mom at a late middle school, high school stage, and then transitioning to college, that there were some cultural changes that led to some challenge. Like, was there an ebb and flow to that, where you sort of revisited some of those challenges as you went through your education, or was it something that was more salient early, or how has that impacted you over time?
Absolutely. And so one of the things that really held me throughout this process and still is sort of the running thread to my life is my connection of my faith in religion and spirituality. So specifically, the type of faith that my mom had to exhibit to be able to help a young male of color, right, in New York City at the time where it was the height of gangs and the height of violence in several places. There were so many things going on in terms of immigrant health and issues. And so really, I saw that resounded faith that my mom had and be able to support me. And that really stuck with me. And throughout time, I developed my own faith, right, in terms of practicing religion, practicing spirituality. And it's actually something now that influences my work today, whereby I've been able to reflect on what are some of the things that kept me throughout the various stages in life. Even when I went away to University of Michigan to study, this was a huge step in my life at the time, because I've never been away from home at that time, right? I've been commuting to school, so it actually stretched me as a person. But the one thing that kept me through that program was my faith, was the ability to understand my position in life as a human being, the connections that I had to the creator, and how is that going to take me from where I am today in the face of uncertainty, in the face of when tuition is due and I'm not sure how tuition is going to be paid, but really trusting that divine source is going to provide for me. And so I really bring that now back into what I do I have a learning academy where I teach sort of what I call the higher consciousness or awareness of success development. And so that's something that I aim to give back upon reflection of what are some of the things that kept me throughout my tenure and even today in my current position.
Wonderfully said and stated. So part of what we're doing here in Public Health America is we're going to have a series that you're kicking off that is focusing on interfaith type initiatives. And I was wondering if you might speak to that in whatever way it may have intersected with you or your work, meaning that, and I'm going to give the incredibly overly simplistic summary of it, and then you'll help me by expanding the definition. But, just looking across different faiths at points of commonality, of points of uniqueness, but also finding across both similar types of goals and objectives and mission that that lead to finding points of connection between peoples as opposed to points of division, and finding points of caring linked to faith to make communities safer and better places. What is your sense of all that and how that can help?
No, absolutely. So the time is now. I would say that you're right. Like in the past, there have been sort of the tendency to focus on divisions, focus on the types of denominations, etc. But what we're really seeing today is that the need for individuals to recognize there's one commonality, right? And so you think of, regardless of whatever faith or tradition, requires you to believe in something, right? And we would like to believe that there's some aspect or a greater purpose, if you will, that each tradition can agree on. The fact that we are facing this time in humanity where we are called to inspect the higher self, right? And so that I think is not dependent on any particular faith. There's a higher calling, a higher purpose, a higher understanding within each individual. And I think that's kind of what we are recognizing across faiths, that there is a common purpose, there is a common belief in a greater good, and we have to elevate that good in order to achieve the type of life that we want to have in post this pandemic, right? We really became what people are calling aware or woke, that we all have a role to play, and that is regardless of faith or denomination. So this is going to be a great path moving forward where we will be able to see a lot more interfaith collaborations, and it is going to be necessary, I might add, that we have this type of interfaith collaboration moving forward, because the pandemics, they don't care what type of institutions you are. COVID impacted people from the Jewish faith, from the Muslim faith, from the Christian faith, Buddhist. Everyone was impacted. So I think people are beginning to realize that we need to come together as a society, put aside some differences, and as you correctly mentioned, find those commonality or those common grounds that allow us to flourish as a society.
Wonderful summary. Finding the commonality, finding the common goals, and working together through faith. I want to thank Dr. Yusuf Ransome for joining us today on Public Health America. I want to thank our viewers for tuning in. I'm your host, Dr. William Latimer. See you next time. Take care.